Welcome to Neuro Quick Reels podcast, where we break down high-yield Neuro PG concepts.
Glad to be here discussing important exam nuggets.
Let us start with a case question about a 25-year-old who loses pain and temperature on the left side from T6 down, while fine touch remains intact.
The lesion is located in the right lateral spinothalamic tract at T6 because the spinothalamic fibers cross early in the spinal cord.
It is crucial to remember not to swap sides, since the dorsal columns cross in the medulla, while the spinothalamic tract already crossed in the spinal cord.
Exactly understanding the crossing patterns is essential to avoid mislocalization of the lesion.
The clinical pitfall many face is confusing the sides when evaluating sensory loss due to the early decussation of the spinothalamic tract.
That is a common error, and careful anatomical review can prevent such mistakes.
Moving to our second question on early syringomyelia, the first sensory deficit appears as a bilateral cape, like loss of pain and temperature.
This occurs because the central cavitation disrupts the decussating fibers in the anterior white commissure.
The cape distribution over the shoulders and upper arms is a hallmark sign that should alert clinicians to syringomyelia.
Indeed, recognition of this pattern is vital for early diagnosis and appropriate management.
It is important to differentiate early sensory dissociation from the subsequent motor involvement in syringomyelia.
Correct the selective loss of pain and temperature while fine touch remains intact guides us during clinical evaluation.
Our discussion on these MCQs highlights the importance of understanding the precise anatomy of the nervous system.
A solid grasp of neuroanatomical pathways facilitates accurate lesion localization and strengthens diagnostic reasoning.
The first question demonstrates how contralateral deficits arise from the early crossing of the spinothalamic fibers.
Keeping track of these pathways is key to avoiding diagnostic pitfalls during examinations.
In the syringomyelia case, the bilateral sensory deficit underscores a central lesion at the level of the syrinx.
Preservation of fine touch in early stages further reinforces the selective vulnerability of the spinothalamic system.
Remembering that dorsal column functions remain intact initially helps reinforce the distinct clinical pattern.
This contrasting pattern is a useful clue that aids in differentiating between various spinal cord pathologies.
These clinical pearls are excellent review points for NEET PG aspirants and build a strong foundation in clinical neurology.
Integrating anatomical fundamentals with clinical scenarios is essential to success in neurology examinations.
Our conversation today highlights the value of careful analysis and awareness of potential pitfalls in neuro cases.
Discussing these cases in depth ensures a deeper understanding and helps avoid common mistakes.
Listeners can find more NEET PG nuggets on Spotify and follow our Instagram pages for additional insights.
Following our social media ensures you will not miss future quick and engaging neuro updates.
Thank you for joining this interactive session and sharing your learning moments today.
It was a pleasure discussing these challenges, and I hope our audience finds these quick reels both helpful and engaging.
That concludes our podcast session on Neuro Quick Reels. Catch you next time.
Thank you for listening and keep honing your neuro skills.